How long is the surgery?
So on average, the surgery probably lasts between an hour and a half to 2 hours. Okay, that's my average. Obviously, you'll be in the operating room a little bit longer than that because you go to sleep first and then you wake up after surgery's over. And it's always a little bit of an unknown when we're talking about surgery for fibroids, even though you've never had major surgery before. Definitely haven't had any surgery in your abdomen. It's hard for me to say, that these fibroids aren't going to make it a little bit tougher for me. Okay.
Yeah, it's big.
Say what? Just because of how big they are.
Yeah.
Okay. I know Heather drew some of your labs today, and then apparently, she had to stick you again. So we'll finish drawing those other lab work after we get done talking.
Okay.
We've also got you scheduled for your coronavirus testing on the 13th. Okay. I usually get the test results back the next day.
Oh, okay.
Like for the cases that I have tomorrow, I've already gotten 2 of them back.
All right.
So I'll shoot if it's normal. I'll just shoot you a My Mercy message saying, "Hey, this is your COVID test result. Everything looks great. I'll see you tomorrow."
All right.
Obviously, if it's positive, then we'll have to delay, postpone your surgery. But we'll cross that bridge if we have to come to it. It'll kind of depend on what your symptom, if you're having any symptoms, and if so, what they are and how severe and all that sort of stuff. Okay. And then Camille already has your post-op appointments set up because she's awesome. Okay. Generally, this is 2 weeks, and this is 6 weeks after surgery. Okay. Let me turn this page. So, as far as these medications, okay, you're okay to continue using or taking the Prevera and the iron, okay, and the Tylenol up until surgery, okay. If you want, you can bring your EpiPen to the hospital, but we've got, well, I'm curious, what are you allergic to? You're allergic to NSAIDs.
Yeah, and almost everything with the pollens.
With what?
Pollens or trees and that thing.
Oh, okay. I mean, if you wanted to bring that with you to the hospital, you can, but we've got EpiPens.
Yeah, I would check if it's not expired because like a year ago or 2 years. Yeah.
Gotcha. So with your surgery, okay, kind of comparing, the report from your ultrasound. Okay, you got the biggest fibroid is sort of here at the top. Okay, and that's why it feels so big, so tall, because it's at the top.
Yeah.
The good thing for me is that usually that actually makes it a little bit easy, okay, because it's not bulky wide. I'm not having to get around. Usually the blood vessels come into the uterus over here on the side. So normally, if the fibroids are down here, that becomes a lot more challenging than if the fibroid's at the top. Okay. And so bear with me. You got another small fibroid kind of over here, I think over to the side, but that's not going to cause any problems because it's only a centimeter big. And your ovaries look good. Okay. I would recommend that we remove the uterus and the cervix. Okay, and then as well as your fallopian tubes. Okay. I would recommend that we leave your ovaries. They appear normal on the ultrasound. Okay. And I don't have any suspicion to believe that they're causing your pain symptoms. Okay. Moreover, with you being in your mid-30s, you're young and healthy. If I were to remove both of your ovaries, then you're going to go through menopause immediately. You'll probably start having hot flashes that afternoon or that evening. And so we would definitely need to talk about hormone replacement therapy to protect your heart health, to keep you from getting osteoporosis. And I don't think that you're going to benefit from having your ovaries removed. Okay.
So only the uterus and the fallopian tubes?
Yes,
Both
ma'am.
of it? Okay.
The removing the fallopian tubes does a couple things. It removes the possibility that you could have a fallopian tube issue where the fallopian tube gets kinked and dilated and gets really painful, and then we have to do another surgery. Theoretically, removing the fallopian tubes actually decreases the chance of you developing ovarian cancer in the future. Okay.
Okay.
Without a strong family history of anything, your risk of developing ovarian cancer at baseline is about 1% to 2% in your lifetime.
Yeah, my sister said that my mom has a cervix cancer when she died.
Oh, really?
Yeah.
Cervical cancer, fortunately, is not typically hereditary.
Okay.
Unfortunately, it is very common.
Okay.
But
So-
your pap smears have been normal, so I'm not worried about that.
That's good.
When we take down all the attachments here, we were cut through the blood vessels here. We actually take an electric knife and actually cut a hole into the vagina,
Okay.
basically right where the cervix and the vagina meet. Okay, so I'm not going to be shortening the vagina.
Okay.
Well, basically we do that to complete the hysterectomy. The goal is to remove it through the vagina.
Okay.
Okay. And then we usually sew that up like the toe in your sock. Yes, ma'am.
So there's no incision on my, what's it?
On your-
Under my belly button?
So, hopefully, this is probably the size of your uterus. I would probably put an incision. I usually put an incision at your belly button. I'll probably put it a little bit above,
Oh, okay.
just to give my camera some room. And then I'll put a couple small incisions over here on the left side, probably one, maybe two on the right side. I'm going to try to take this out through the vagina.
Okay.
Okay. There is the possibility, okay, and this is where I need you to kind of tell me what you want me to do. There is a possibility with the size of this fibroid on ultrasound that I may not be able to take it through the vagina.
Yeah.
Okay. All right. I may not be able to take it out through the vagina in one piece. Okay. For someone who is young and healthy like you, who has never received any pelvic radiation or anything like that, the chance of this fibroid actually being a cancer is incredibly low. Okay. Somewhere in the realm of one in 2,000 to as low as 1 in 10,000. So very, very small. Okay. However, so sometimes what we can do if we have a uterus that's big and won't fit out through the vagina in one piece, what we can do through the vagina is sort of cut into it to pull the fibroid through and then pull the uterus through. Does that make sense?
Mm-hmm.
So you're sort of making things a little bit smaller, but that may involve me cutting into the fibroid. Okay. And if it were to be cancer, obviously that would probably be a bad thing. Okay.
It's broken inside.
So even though I'm not concerned that this is cancer,
Yeah.
Okay.
Precaution.
if I can't get this out through the vagina, I would like you to tell me, do you want me to cut it up so that I can hopefully just keep you from having a bigger incision? Or if I can't get it through, do you want me to make, usually it's about this big. It's not like a C-section incision. It's in the same location, but I usually need to make about a 4 or 5 centimeter skin incision down low, right above your pivot bone to get it out that way. Does that make sense?
Yeah, it'll be easier.
Safe? It's safe. Is it easy? Is it easy for me? Yeah. It's like making a really small C-section incision. It can make your pain control a little bit worse just because it's a bigger incision, but it doesn't necessarily mean the difference between you staying a couple nights in the hospital or not.
Yeah. How long is that recovery?
That is not something that typically adds to your recovery. Okay. It may make you a little bit more sore for a few days, but that's not that's not something that turns this in from a 4 to 6 week recovery to like a 6 or 8 week recovery or an 8 to 10 week recovery.
Because on the pain I'm worried about because I can't take,
You can't take NSAIDs, right?
So
Just do me a favor. Just think about it and just let me know if you want to let me know the day of surgery, then that's totally fine.
Okay.
There's not a right or a wrong answer. Generally speaking, studies using statistics and that sort of thing sort of lean more towards the option one of cutting this up through the vagina to just pull it through the vagina when the woman is 50 years or younger. Does that make sense?
Okay.
Just because the risk of this being a cancer with you being so young is so low. Okay. Whereas if you were 60 or 65, then we would be having a very, I would encourage you to tell me to make an incision and take it out through the abdomen.
Yeah. Because this one is the one fibroids, like the last time I got it's become bigger. Because the last time is small, right?
Yeah.
And now it's
Well, it wasn't small, but it was smaller.
Yeah.
Okay. Right now it's measuring about 7 centimeters.
Like a fetus.
Like a small baby's head.
Yeah. Thing.
Okay. So so just think about it. There's not, like I said, there's not a right or a wrong answer. Okay, and it's not going to adversely impact your recovery. It may make it to where, it may make it to where you're a little bit more sore. You may hurt a little bit more, but that's not generally something that is going to cause you to need to stay in the hospital for 2 or 3 more days. Okay.
Yeah, I will show you a message.
So generally speaking, with any kind of major surgery like this, the risks are bleeding, infection, and damage to surrounding structures. Risk of bleeding, relatively low. Okay, we've got fancy instruments that kind of seal, coagulate and seal blood vessels before cutting. We take the special precautions with fibroids because sometimes the fibroids cause your blood vessels to be a little bit bigger. Okay. But I certainly don't anticipate you needing something like a blood transfusion. Okay. We'll give you antibiotics through your IV. We'll clean your belly off with special soap. We'll use sterile instruments, obviously. Do me a favor for the week leading up to surgery, don't shave your pubic hair if that's something that you do. The microscopic abrasions that you create with the razor blade actually increase your chance for an infection. Okay.